Thank you, Senior. As Senior said, today we are going to learn about lymphedema. I hope you might have seen once in your career in lymphedema. How many of you have seen lymphedema in career? Okay. Anybody else? Only one person? That is too bad. We all nurses. Okay. Thank you. Let me share my screen. So before we are moving to the lymphedema part, we need to understand that we all know that lymphedema is related to lymphatic system. So lymphatic system is going through the lymphatic fluid. So before that, we need to understand that what is lymph. So lymph is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries. Then it enters to the lymphatic vessels, to lymph nodes, again lymphatic vessels. So finally it goes to the subclavian vein. So, and also we understand that this is a part of lymphatic system is a part of circulatory system, because after that lymphatic system, the flows that ends with the circulatory system. So after filtration, that lymphatic fluids will go to the that subclavian vein, and then it moves to the circulatory system. So this is the part of circulatory system too. So what are the functions of lymphatic system? What are the functions of lymphatic system? You can unmute yourself and tell your answers, or you can put your answers in the chat box. What are the functions of lymphatic system? Any answers? I am waiting here for your answers. What are the functions of lymphatic system? At least one function you should know. So please share your answers. Saraswati said it maintains the fluid level in our body. Very good. It protects body from infection. Kalaivan is it. It protects body from illness. Okay. It provides immunity. Very good. Okay, thank you. Thank you for your answer. Let's see one by one. There are three major functions of lymphatic system. One is reabsorb excess interstitial fluid. As you said, it maintains the fluid balance. So whenever the tissue, that interstitial fluid accumulation there, the lymphatic capillaries will be absorbed from the extra fluid from the interstitial space and goes to the lymphatic vessels. Finally, it goes to the subclavian vein. That way we can able to maintain our fluid balance. Okay. And the second one is transport dietary lipids. And the third one is, as one of you mentioned, it will help us to prevent infections, lymphocyte development and the immune response. So these are the three major functions of lymphatic system. So this is our circulatory system. Can you please explain this circulatory system? So this is the circulatory system. We all know that. Saraswati, do you want to explain this? Anybody else? So here, this is our circulatory system. From the upper part of the body, the deoxygenated blood will be collected through the left superior vena cava, and the lower part of the impure blood will be collected by the inferior vena cava, and finally it goes to the right atrium. From the right atrium, with the help of pulmonary artery that carries to right and left side of the lungs for purification. Okay. So from you can see that from the lungs, when the deoxygenated blood goes to the lungs, there is a union of deoxygenated blood and the oxygenated blood will be that means the arterial capillaries and the venous capillaries are communicating together for exchanging the blood. So this is this is our circulatory system. So after that, after purification happened, with the help of the pulmonary vein, that in the pure blood, that means oxygenated blood will be carried from the lungs to the left atrium. From the left atrium, that blood goes to the left article with the help of bicuspid valve. From that left ventricle, the aorta will push the pure blood to the body. Okay, so that this is our circulatory system. Why I am telling this is, so here we have to understand that there is a purification happening in your upper part, lower part, and the lungs also. So there is a union of arterial capillaries and the venous capillaries together. Okay. So coming to the lymphatic capillaries. What is lymphatic capillaries? So I already mentioned in our interstitial space, there are a lot of lymphatic capillaries there. So there are the lymphatic capillaries will be absorbing the extra fluid from the interstitial space, and goes that fluid from there, it goes to lymphatic vessels and then lymph nodes and then again lymphatic vessels and finally subclavian vein. So here we need to understand that lymphatic vessels, lymphatic capillaries has a blind end and the single layer of overlapping endothelial cells, and more permeable than that of blood capillaries. It is more permeable. So that lymphatic capillaries are able to absorb that big molecules also, that the blood capillaries. So coming to the lymphatic capillaries, there are three major functions of lymphatic system. One is the dietary supplement. Okay, so here in our small intestine contains special type of lymphatic capillaries called lacteals. So here lacteals pick up not only the interstitial fluid, lacteals will absorb the lipid soluble vitamins also. So here the transportation of lipids also there. So here, one important thing we all know that during the nursing student period, we learn this thing. So here, because of the lymphatic, that lymph fluids mixed in the interstitial, that fluid can cause milky color due to lipid, so that we usually call it as kite. So this is regarding the lymphatic capillaries in the lacteals. So coming to the lymph nodes. So we understand that what is lymphatic capillaries and what is lymphatic capillaries in the intestine, the lymphatic capillaries in the large intestine, and now we are going to learn about lymph nodes. So it's around 600 to 700 numbers of lymph nodes in our body. So it's usually small, round and or oval shaped things located along the pathway of lymph, that lymph vessels. In between the lymph vessels, there is a lymph node is visible, and the length from 6 to 25 millimeters. Typically found in clusters, receive lymph from the many body the regions, and lymph nodes are also found individually throughout the body tissues. So you can see that picture, that green color, that round shaped, that is all the lymph nodes. So it's around 600 to 700 lymph nodes in our body part. So how the lymphatic system works? The first one is lymphatic system circulate the protein, that protein-rich lymphatic fluid throughout the body. Okay, so it that whenever they that move the that circulate the lymphatic system, it collect the bacteria. So it will usually the lymphatic fluids, the interstitial fluids, usually that contains bacteria, virus, and waste product also. So whenever the lymphatic capillaries absorb the fluid from the interstitial space, then it goes to the lymph nodes. From the lymph nodes, there is a filtration there. So from the lymph nodes will be doing the filtration. That times if there is a bacteria or virus or any waste product there, there is that waste are flushed from the body. Then that clean lymphatic fluid drained in the that bloodstream. So during the lymphatic function, lymphatic system flows, there are sometimes bacteria, virus, and waste products are there. In our lymphatic system, the lymphocytes will be fighting against the disease, and the filtration is also happening there. So after filtration, the clear lymph fluid drains into the lymphatic, the blood stream. That means the circulatory system. So this is the pathophysiology of lymphatic system here. So I already said that lymphatic fluid usually in the interstitial space. From the interstitial space, the lymphatic capillaries absorb from the extra fluid. Then it goes to the lymphatic vessel. Then lymph node, again lymphatic vessel. Then lymphatic trunk, collecting drug. Through the collecting drug, it goes to the subclavian vein. This is the pathophysiology of lymphatic system. So what is lymphedema? Okay, so here we need to understand that now we all know that where the lymphatic fluid accumulation there. So from the interstitial space, whenever the arterial capillaries and the venous capillaries communicating together, there is a chance of oozing out of fluid in the interstitial space. Which fluid? That fluid which is lymphatic capillaries, that accumulated fluids carry out with the help of lymphatic capillaries. Okay, so here, what is lymphedema? If there is a that accumulation, the accumulation of fluid is there. If there is any damage into that lymphatic system there, if there is any damage into the lymphatic system there, there is a chance of accumulation of fluid in the interstitial space. Okay, so that is called lymphedema. Here, the pathological accumulation of protein-rich lymphatic fluid into the interstitial tissue space due to an imbalance between interstitial fluid production and transport. Okay, so here is that interstitial fluid production will be there, the transportation will not be there because of the damage of the lymphatic system. For example, if the patient is having if the patient is diagnosed with the cancer carcinoma breast, so the curative surgery time, we remove the adjacent lymph nodes too. So we usually done radical mastectomy for that patient. So when we remove the breast, we will remove the adjacent lymph nodes. So after that, there is no way to the fluid, the lymphatic fluids goes up to the lymph. Okay, so there is the axillary lymph node is already taken. So there is no axillary lymph node is there. So the lymphatic capillaries are working, but there is no way to go up to the fluid. So that time, that fluid is accumulated there. Okay, that is called lymphedema. So here is a pathological accumulation of protein-rich lymphatic fluid into the interstitial tissue spaces due to an imbalance between the interstitial fluid production and transportation. So here, if there is an arterial filtration is normal, there is a chance of fluid accumulation in the interstitial space there. That is called. So if there is a damage into the any type of damage in the lymphatic system there is a chance of accumulation of fluid in that area. So there are two classifications according to the International Society of Lymphology. There are two different classification. One is primary and the another one is secondary. The primary one is congenital lymphatic dysplasia because of the congenitally from the birth itself there is a malformation of the lymphatic system there. There is a chance of that lymphedema. So this is the primary one. The secondary is anatomical obliteration of lymphatic system. Okay, if there is any change in the existing anatomy, because of that, that patient developed lymphedema, we call it as secondary lymphedema. So again, secondary lymphedema divided into two, non-malignant and malignant. So non-malignant is trauma, road traffic accident. Like if there is any major accident there is a chance of damage of the lymph nodes. So that can cause the patient develop lymphedema, major burns and the infection, recurrent infections there. There is a chance of tissue fibrosis and then the patients develop lymphedema. And iatrogenic surgery and radiotherapy. Again, if the patient is underwent any surgery, major surgery like mastectomy, radical mastectomy, along that during the surgery, we used to remove the adjacent lymph nodes that time. So our aim is to prevent the spread of infection. So because of that, the patients might be developing lymphedema. So here, because of that removal of adjacent lymph nodes can cause the patients develop lymphedema. And the radiotherapy. If you do the radiotherapy for that area, so there is a chance of tissue fibrosis there. Then again, the patient can develop lymphedema. And malignant, come to the malignant part, primary lymphomas and the secondary recurrence. So this is the that secondary lymphedema. So from this, we need to understand that the patients develop lymphedema not only for a cancer patient, it can develop from non-cancer patients too. So coming to the diagnosing. So we need to understand how to diagnose the lymphedema. So other patients also can develop edema because renal problems, acute renal failure patients can develop lower lymphedema, lower leg edema. So we need to understand, we need to differentiate the that edema. whether the patient is having lymphedema or other edema. So how to diagnose this? We need to take a proper history. Like you can ask the patient about is there any unknown cause, and the next question is there any disease related or trauma related? Is there any previous major trauma or any road traffic accidents happen? After that, maybe gradually the patients develop lymphedema. So you can ask that history also. Any disease related things you can ask. And also you can ask the treatment history also. Any recurrent infections like recurrent cellulitis there. Might be developing lymphedema. So these all things you can ask along with the history. So proper history is very, very important. You have to take a proper history. So after that, you can do the clinical examination. So here, there are three stages of lymphedema. The first one is pitting edema test. So it looks like that orange peel skin. So if there is a pitting edema stage there, you can apply your finger pressure on that area. You can see your finger point there. So this is the pitting edema stage. In this stage, we can easy to manage. We can able to reduce the edema in this stage. So if you are not treat this stage, that edema goes to the second stage. That is the tissue have become fibrotic and hardened, and the tissues are no longer soft. So that is stage 2. Stage 2 also we can manage. We can try to manage. We can, but they need the second stage and the third stage need take time to control the edema. And the third stage tissues are considerably hard and cartilage formations. These are the 3 stages of lymphedema. So this is the stemmer sign. If the patient is, this is only one sign which we have seen in lymphedema, that is stemmer sign. So if the patient is having lymphedema there, we are not able to pick up the fold of the skin over the proximal phalanx of the second toe. This is the stemmer sign. So in lower leg edema, if the patient is having edema, we are not able to pick up the, usually we can able to fold the skin over the proximal phalanx of the second toe. If you tried in your legs, you can able to fold your skin over your proximal phalanx on the second toe. But in lymphedema patients, we can't. And in the upper lymphedema and the middle, the finger, we are not able to fold the skin on the top of the middle finger. So this is the upper lymphedema stemmer sign. So here you have seen the lower lymphedema stemmer sign. In the upper lymphedema, stemmer sign, if the patient is having edema in the upper limb, they are not able to pick up the fold of the that middle finger fold of skin. So that is upper limb lymphedema. So coming to the other diagnostic methodologies, here soft tissue imaging, the MRI and CT scan. So here we can able to understand to determine the extra fluid volume. And the second diagnostic methodology is lymph vessel imaging. Here also you can able to detect abnormalities. The third one is bioimpedance spectroscopy to measure interstitial fluid volume. So here this is we that already learned about 2 different stage, not the stage, primary and the classifications. 2 different classification, primary and secondary that edema. In the primary stage, we are that from the congenital stage, also the primary means from the birth itself, there is a congenital malformation of the lymphatic system there. There is a chance of lymphedema there. So here we need to understand that whether there is any abnormalities, how much extra fluid volume there. So we need to measure the interstitial fluid volume and all. In the primary, if there is a primary lymphedema there, we can apply these all diagnostic methodologies. But in palliative care, so we know after the curative treatment or any that any treatment or any other problems can cause that lymphedema. In palliative care, we don't do these type of diagnostic methodologies. Here we do the proper examinations, like proper history taking, and after that we can do the physical examination, and then you can finalize the edema, whether the patient is having lymphedema or other edema. Coming to the problems, lymphedema problems. So we need here, this patient is having lymphedema. One lymph is huge than the normal one. This patient is physical problem, having pain, discomfort because of the fluid volume. The fluid, whenever the fluid level increase, the skin will be stretching. So more than that, that fluid volume is increasing too much, that can cause pain. So the patients might develop pain and discomfort and tightness, so heaviness and fatigue, numbness, impaired mobility, and loss of functions. These are the physical problems the patients might have develop. So because we have to understand, whenever the patients come to you, you have to assess the physical problems. You can ask them whether the patient is having any pain or discomfort, heaviness or fatigue. These are the things you can ask for the patient. And the coming to the psychological problems, psychosocial issues, here body image. This is one of the major problem. One lymph is normal, the another one is too big. Because of that fluid accumulation, the patients can develop too many physical problems and psychological problems. They are not able to do their that work alone. They always depend others. Here, loss of independence is also another cause. Sometimes loss and change of employment. They are not able to do their previous job after the disease occurs. So that will be affecting the patients emotionally and psychologically, and they are not able to wearing the clothes and shoes. So this is also, they are not able to, if the patient is having lower limb lymphedema, they are not able to wearing the shoe properly. They are not getting shoes also sometimes. So that will be affecting the patients emotionally, and anxiety, depressions. So sometimes they might be thinking that if the patient is having developing lymphedema, they might be thinking, so the disease is spreading to the limbs also. So because of that, they will be anxious. Here, so after surgery, we need to give a proper explanation. We need to give a proper education to the patient and the family. So after surgery, we should remove the adjacent lymph nodes also. So because of that, the patients might develop lymphedema. So we need to educate the patient about that. So before that, so after the surgery, if we do the proper education to the patient and the family, they will try to prevent the accumulation of edema. They will do the preventive exercise and all. So if they develop edema, they will be thinking, okay, they should understand, okay, maybe because of the edema, because of the lymph node is not there. So here we can able to reduce the anxiety level. If they are thinking like that, we can able to, if you do the proper education to the patient and the caregivers, we can able to reduce the anxiety and depression level. If the anxiety is not given, if you are not give special attention to the anxiety period, the patients will go to depression. So if they have depression, we have to find out whether the patient is having depression there. you can give a special care to that patient and try to involve medical social workers in your group and or psychologist in your patient. And so here, this patient need a multi-disciplinary team treatment. So good teamwork is necessary for effective treatment. So if the patient is having any psychosocial issues, there better to include the medical social worker or psychologist or psychiatrist in your group and try to give that treatment for that patient and give a counseling to the patient and try to solve that problem. Coming to the management part, here there are 4 principles. One is skincare, the second one is massage, the third one is compression bandage, the fourth one is exercise. So these are the 4 principles of management: skincare, massage, compression bandaging, exercise. And the intermittent pneumatic compression pump is also you can use. I'll tell you later about intermittent pneumatic compression pump. So coming to the massage. So before doing the massage, you need to give a proper education on their skin. You can educate, tell the skincare part later. Before doing the massage, you have to do the proper measurement. So when we do the measurement, when we take the measurement, you have to take the unaffected limb and the affected limb. Okay, then only we can able to differentiate the that edema. So you can take the unaffected limb and the affected limb. So here is the upper limb. You can give a comfortable position to the patients. So here number of if you take the measurement for the upper limb, you can take feel the head of ulna. From the head of ulna, you can take 2 centimeter. From that part, again every 4 centimeter you can mark it, and after that you can take the circumference. In case of lower limb edema, from the ankle joint plus 2 centimeter, then every 4 centimeter. Okay, so this is how we should take the lymphedema. When we take lymphedema measurement, you have to take the non-affected and the affected limb measurement. So coming to the skincare, always apply simple moisturizing cream to that area. So after, if there is a wet area there, so after bathing, so because that time they can if you tell you can educate the patient to apply moisturizing cream, so that will help to long lasting, that the skin is moisturizing always. Here, and the second thing is keep the skin clean and dry. So and the next the third one is meticulous drying between the digits. So there is a chance, if you are not giving special attention to the digits, there is a chance of accumulation of dirt in the digits, and that can cause fungal infection. So we can give the special attention to the digits also. Avoid injections and venipuncture. Here there is no lymphatic the lymph nodes in that part, that area. So there is a chance of the cellulitis or infections. So better to avoid injections and venipuncture. Avoid ulcers, avoid blood pressure cuffs, avoid injury, and if there is a injury or any cut there, so keep the area clean and dry. If there is a signs and symptoms of inflammation there, they can take antibiotic treatment for that. Otherwise, it will goes to the cellulitis also. So if there is a signs and symptoms of inflammation there, you can refer the patient to the physician and to take advise the patient to take a course of antibiotics and to control infection. And also you can tell the patient about to avoid carry heavy things. If they are taking heavy weights, because of that pressure that increase because of that heavy weights. If they are taking heavy weights, they can apply more pressure on that area. If they apply more pressure on that area, the capillary filtration will increasing, and because of that, there is a chance of fluid accumulation. It's better to they can take small weights, instead of heavy weights. Coming to the massage. So how to do the massage? Here we all understand that there is accumulation of fluid in the limbs. We need to push the fluid from the congested area to the decongested area. Okay, so here is the congested area is the lymphedema area is the congested area. So we need to push the fluid from the congested area to the non-congested area. Here two the ways of massage here. One is manual lymphatic drainage and the another one is simple lymphatic drainage. The manual lymphatic drainage is the trained person. So one of the nurse or a physiotherapist will be doing that. They should know how much pressure is apply for moving that apply for the lymphedema space. So that is the manual lymphatic drainage. So that is one of the trained person like a nurse or a physiotherapist will be doing for that massage. That we call it as manual lymphatic drainage. The simple lymphatic drainage is after the admission. So we can train the patient and the caregivers about the simple lymphatic drainage. That time the patient and the caregivers should not touch the affected area. Okay. So when we do the manual lymphatic drainage, we nurses and the physiotherapists we know how much pressure is applied on that area, but the caregivers doesn't know. Even you train the caregivers on the patient also, they don't know how much pressure is applied. So they should not apply that affected area. If they apply too much pressure on that area, there is the chance of fluid accumulation more. So after discharge, they can do the simple lymphatic drainage. So before moving to the simple lymphatic drainage, I'll explain how to do the manual lymphatic drainage. So we can start with a deep diaphragmatic breathing. So before I said, if we have it's around 600 to 700 lymph nodes in our body. Okay, here if we do the deep diaphragmatic breathing there, so all lymph node will be stimulated, and if we push the extra fluid to the adjacent lymph nodes there, that adjacent lymph nodes are ready to collect the extra fluids. So that is why we encourage to do this deep diaphragmatic breathing first. And the second is stimulate the superficial lymph node. Okay, after doing the deep diaphragmatic breathing, you can do the superficial lymph node stimulation. For example, we have a neck nodes and the periauricular lymph node, then and the submandibular lymph node, and here also we have a lot of lymph nodes. We can stimulate the neck nodes, and then we can stimulate the unaffected side axilla. If the patient is affected the left side of lymphedema, you can stimulate the right side of lymphedema. Okay, right side of axilla. Here, the right side of my axilla is the lymph node is active, but in my left hand the left hand lymph node already removed. Here there is no lymph node in my left axilla. There is no need to stimulate the left axilla. Okay, after that is stimulating the superficial lymph node like neck lymph nodes, you can do unaffected axilla. So that means opposite side of the affected axilla. Then you can stimulate the groin. Okay, so these are the major lymph nodes we can able to stimulate easily. Here, the first you can do the deep diaphragmatic breathing, and then you can stimulate the superficial lymph nodes like neck nodes, non-affected axilla, and groins. Then you can stimulate the unaffected node here. So after stimulating the superficial lymph node, neck, axilla, and groin, then and also I already said unaffected node also. Then you can massage the proximal part. Here we can, here is the proximal part. This is the distal part. You can push the fluid from the proximal area first and then go to the distal area. Here you can massage from here to the chest area. So here in our chest area and the opposite side of the axilla, all lymph nodes are active. And if you push the fluid from the congested area to the non-congested area, the extra fluid will, they are ready to collect the extra fluids. Our that duty to push the fluid from here to here, the chest area. So from the, if the extra fluids comes to the chest area or the neck regions, that extra fluids will carry the active lymph nodes. Again, if you apply, whenever you do the massage, you can give a gentle pressure. Your gentle pressure is enough to move the fluid. Here, the fluid is accumulated in the interstitial space. So your gentle pressure is enough to move the fluid. So if you do the, if you give a more pressure on that area, that can cause increase the arterial filtration, and again there is a chance of accumulation of more fluid. Here this patient is need only gentle pressure, and this is one of the trained practitioner will be doing manual lymphatic drainage. After that you can do the deep diaphragmatic breathing. Okay, so this is the step of massage, manual lymphatic drainage. So after, if the patient is in the hospital, you can do the, if there is a nurse or a physiotherapist there, you can do the massage. You can do the massage. And when the patient is getting discharged, you can train the patient about the simple lymphatic drainage. Like they can able to do the deep diaphragmatic breathing and stimulate the superficial lymph nodes also. They can able to do the superficial lymph node stimulation. Okay, then you can do they can do the compression bandaging. Here, after the massaging, they can do the compression bandaging. Here you can see that here lot of lymph nodes are there. So these all that greenish color, these are the lymph nodes. We can able to stimulate the lymph nodes. If you do the stimulation, that if you push that extra fluid in that area, you can, that lymph nodes will be carry the extra fluids. So these are the contraindications for massaging, manual lymphatic drainage, and the simple lymphatic drainage. Acute cellulitis. If there is acute cellulitis there, the patients will have pain. So here, that if the patient is having cellulitis there, you should not do the massage. And renal failure. If there is a renal failure there, if you push the extra fluid there is a chance of overload, and again there is a chance of more problems. And unstable hypertension there, you should not do. And severe cardiac insufficiency also. If there is a lot of cardiac problems there, if you push extra fluid there is a chance of fluid overload. And hepatic cirrhosis with abdominal fluid like ascites. If there is ascites there, you should not do. And superior vena cava obstruction. These are the contraindications of that massage. So after the massage, you can do the bandaging. So here our idea is push the fluid from the edematous area to the non-edematous area. Here, if you do the spiral bandaging, so initially you can do the spiral bandaging to the patient. We don't know whether the patient is tolerating or not. So you can do the spiral bandaging initially. After 1 week, you can do the follow-up, and then if the patient is able to tolerate the spiral bandage, better you can go for the multi-layer bandaging like figure of 8. If you do the figure of 8 bandaging, that multi-layer bandaging, so that will help to push the extra fluid from the interstitial space to up. So that way we can able to reduce the edema. So here also, if the patient is having lower leg edema, also you can do the lymphedema bandaging Here you can you can see that finger bandaging and the leg bandaging, and also stockings. If they have a unilateral edema there, you can advise the patient to use stocking also. If they are using stockings, they should remove at night. So during the daytime, they can wear stockings too. So if they are not able to wear stockings, you can advise the patient to do the multi-layer bandaging with the help of crepe bandage. So after bandaging, you should encourage the patient to do the exercise. So our aim is to after the multi-layer bandaging, there is that tightness will be there. If you do the exercise, that fluid will goes up and the extra fluid will be moved from the affected area to the non-affected area. Here you can encourage the patient to normal activities, normal functioning, mobility and activities. If they are not able to do the exercise, you can do that. Nurses or the caregivers, you can encourage the caregivers to do the exercise. And also the type of exercise, you can start with the low and moderate intensity exercise. So they should not take a heavy lifting weights and all. If they are taking not the more weights, there is a chance of accumulation of fluid again. Here after, so if they are doing any exercise, they should wear a compression garments like any stockings or multi-layer bandaging. Otherwise, there is a chance of fluid accumulation. So after wearing stockings or compression bandaging, they should encourage the patient to do the minimal exercise. If they are doing the ranges movement exercises, one for shoulder, one for elbow, and one for wrist. For fingers, you can give a physiotherapy ball and ask them to squeeze the ball. So that will help to push the fluid up. So after exercise, you can you can advise the patient to lymph elevation also. They can take one or two pillows under the lymph, keep under the lymph, and the lymph should be elevated after the exercise and after the bandaging. So otherwise, the fluid will be accumulated in the lower limbs, again cause edema. So if you do the lymph elevation, that will help to move the fluid from the affected area to the non-affected area. So coming to the intermittent pneumatic compression pump, here this is the intermittent electrical air compression pump attached to the inflatable plastic garment that is placed on the affected limb. You can see that picture. If the patient is having edema, you can see that these type of garments there. They can insert their limbs, affected limbs in that area, so that that back, and apply there is a the reader there, that for one regulator there, we can adjust the pressure. So usually 30 to 60 mm high G pressure is there. So duration 30 to 120 minutes, depends on the edema. We can adjust that the duration and the pressure also. In my experience, in the stage 1 lymphedema, it will be held. So stage 2 and stage 3 edema, if you do the intermittent pneumatic compression, so that that patient is very feeling very heavy and painful and all. So if the patient is having stage 1 lymphedema, you can do the intermittent pneumatic compression pump. So coming to the complication, there are two complications of lymphedema. The one is cellulitis. So here is a inflammation, infection on the tissues here. So if the patient is having cellulitis there, you can refer the patient to the physician and take ask them to take a course of antibiotic. Amoxicillin is the drug of choice for controlling these kind of infections, streptococcal infection. So you can refer the patient to the physician. And in this stage, if the patient is having cellulitis, you should not do the bandaging and massaging on that area. After controlling cellulitis, you can do the massaging and bandaging to the area. So the second complication is lymphoria. Lymphoria is oozing out of lymphatic fluid from the lymphedema side, that is lymphoria. If the patient is having lymphoria, you can do the massaging, you can do the bandaging, gut bandaging. So if you do that non-adherent dressing to the leakage area, and then you can do the crepe bandage. So if you apply pressure on that area, that there is a chance of fluid, that fluid oozing out the fastly, we can able to control the edema. So here there is no contraindication for applying pressure bandage. So if there is a leakage there, you can apply 1 or 2 gamji pad, the dressing pad on that area, and then you can do the pressure bandage. So all that accumulated fluid will come out. So thank you. Any doubts? If you want to share any experience, you can share your experience also. If you have seen lymphedema in your settings, you can share that part also. One question: if the methyl prednisolone can be used for treatment of lymphedema? No, we cannot use any steroid. We can that steroid may not help. Okay, here is the accumulation of fluid in the interstitial space. So whenever that arterial and venous capillaries union there is a chance of accumulation of fluid. So usually in the interstitial space, your steroid may not help. In palliative care, if you give the steroid, that will help to reduce the peritumor edema. Any other questions? So next question: can lymphedema occurs bilaterally? Very good question. Yes, it can occur bilaterally. So if the patient is having lymphedema bilaterally, means both limbs, both upper limbs are affecting, you can massage the fluid from the axilla to the groin area. Here the steps are normal. You can do the deep diaphragmatic breathing and then do the stimulate the superficial lymph nodes. Then you can stimulate the groin, and then you can massage the fluid from the axilla to the that groin area. That groin part is that groin area and the chest area, back side of that side areas. The lymph nodes are not working and normal. They are that lymph nodes are active, so you can push the fluid that area from the upper limbs. If the patient is having lower lymphedema, do one thing: you can massage from the lower part to the upper area, chest areas, backside area, and upper that axilla also. You can stimulate the axilla, both side of the axilla, and massage the fluid from the lower part to the upper part. So after mastectomy, we advise the patient to do simple exercise like hair combing and wall climbing exercises, which can help to. Yes, Kalaibani said definitely after we can able to prevent lymphedema if you do the proper education after surgery. So in the post-operative period, we should give a proper education to the patient and the caregivers about the prevention of lymphedema. They can do simple exercise, they can do simple massaging. So they don't know, not taking heavy weights, not taking any heavy that exercise and all. So if they are doing that things, there is a chance of accumulation of fluid. So always we should educate the patient during the post-operative period on this. So if you do it properly, there is a less chance of developing lymphedema. The next question is there is any difference between malnutrition, edema, and others? I don't understand the question.
So I'm Dr. Sridevi. I think malnutrition edema, it will be due to the lack of protein, and so that's the reason for edema. But which cannot be drained by all this massage exercise. You have to replace the protein so that the edema may be reduced. So yes, there is a difference between the treatment differs, the approach differs. Yeah, so there is a difference. There is a question from Jijo. Any kind of thrombolytic medication can be effective. I have not read about any role of thrombolytic medications because obviously here the reason is not a thrombus per se. So I don't think so. I have not heard about, not read about the role of antithrombolytics in lymphedema. So, Mohammed Falah, in malnutrition, the edema might be probably due to the lack of protein. So, for example, when you see a patient with cancer where there is a less protein, where there, you might see edema on the limbs and over the abdomen, where you replace with albumin infusions. So, in the malnutrition, the edema might be due to the protein imbalance that is happening to the body. But in lymphedema, as Sister Sheeba told, it is because the lymph nodes are unable to pump or circulate the lymph. What all medication can use with patient lymphedema?
No medications. Here we understand that there is a accumulation of fluid in the interstitial space. There is no way to reduce that edema. We can able to we only way to give a massage and pressure on that area. Apply compression garment that area. That way we can able to reduce that edema. No medication. So nowadays, some physicians give, sometimes they give diuretics. If you give diuretics, that will help to reduce the capillary filtration. So that blood volume, that will help to reduce the blood volume. That way, that capillary filtration is reduced. Comparatively reduced. That way we can able to reduce the edema. So that is why the physician give diuretics, but usually the diuretics may not help. In our experience, the diuretics not working well. We are not preferring any diuretics for this type of patients. We usually give massaging, bandaging, and exercise. So we have seen many patients good results after this type of that massaging and excess bandaging. Good result we have seen that patient. We have seen many patients. Good results also. You can also try these things in your settings. So which type of position provide to the patient during the massage? Lying down is the best position. So ask the patient to lying down, and the supine, you can provide supine position to the patient, and you can do the massage. So after massage, you can do the bandaging, and so after bandaging, you can do the exercise, and then you can elevate the affected limb with the help of pillow. One or two pillow under the keep under the affected limb. That way we can able to elevate the limb. So if you do if you elevate keep the limb elevated, so there is a chance of that fluid will be the moves to the non-affected area. So, if a patient has cellulitis, what are the antidepressants used for? So, that we usually antidepressants are used for depression patients, and in palliative care we used for neuropathic pain. Here there is no role. If there is a cellulitis there, you can give a antibiotics for that patient. So it okay. One more question, ma'am. Okay. So we'll send the answers. Okay. So we can move on to the next case presentation. Maula.
Yes, ma'am.
Yes. Over to you.
Miss Maulon, can you see that?
Yes, ma'am, I can see.
You can start
Yes,
now,
ma'am.
please.
Okay. Very good evening to all of my colleagues and to my. So I'm going to start with my case presentation. So I'm. Oh, so I'm going to introduce myself. My name is Bayawan Biang Maulong, working as staff nurse in Civil Hospital in Shillong. So my case presentation this evening is on breast cancer. Next slide. So let's start with the present complaints of the patient. Say like our patients having this breast pain, lump on the lump, change in the breast shape, fluid coming from nipple, cracked nipple, insomnia, anxiety, and she also have like weakness. Next, now we will go to the history of illness of the patient. Patient was apparently well before 1 week when she developed the sign and symptoms of cancer, that is pain in the breast, lump breast, change in the breast shape, and loss of appetite. Patient is known as a case of breast cancer. Patient also have present surgical history, that is mastectomy, and she was diagnosed with a cancer on the 10/12/2020, and mastectomy done on 28/12/2020, and she weekly she have do the treatment 3 weekly CT and along with radiation daily. And for chemotherapy, she have completed 5 cycles of chemotherapy with on the injection cyclophosphamide 750 mg, injection doxorubicin 12 mg, injection doxorubicin 25 mg, and radiation she have completed for 28 doses. Blood transfusion for 2 units was transfused. Patient is taking tablet morphine, was taking also for morphine for pain control. On examination, I found that she's undernourished, thin and weak, wound not healed properly and having pain on it, well-oriented, foul-smelling cancer lesion present, activity dull and look anxious, bowel and urinary elimination, personal hygiene maintained. And significant investigation. So sorry, there is.
Ms. Maulung, if you have any connectivity issues, you can turn off your video and continue.
Okay, ma'am. Yes, no, the light went off in my room. That's why I shifted to another room. I'm so sorry. So the thing what happened, my patient, she's getting is like supportive care with nutrition support, routines, frequent oral intake. She have IVF like NS, saline, RL, dextrose injection, pain with therapy, cancellation management with daily dosing.
Ms. Maulung, please continue. Hello. I think she have lost her network connection.
Okay. So I'll read that case presentation. We have lost her. So here, her treatment and significant investigation, supportive care with nutritional support, protein supplement, frequent oral intake. So she had, she was given IV fluid and normal.
Sorry, ma'am, I'm a
Yeah,
problem
you
network.
can. Yeah, okay, you can continue. You can continue.
Shall I continue?
Yes, you can.
See, like on. Let's continue with this treatment and the significant investigation with our patient. She just having a supportive care with her with nutritional support, protein, supplement, frequent oral intake, and she have got IBF also with normal saline RL like dextrose with injection along with injection MVI, and with the pain management with tap morphine. Cancellation management, we are doing her for daily dressing, and the other blood investigation, we have done all like CBC, KFT, all those like serum electrolytes. These are all the treatment that we are regarding with the investigation, along with the investigation. Next slide. On medication, right? Normal saline, these are all the medication that our patient being administered, like NS, normal dextrose, along with the injection MVI. She's getting injection dexamethasone, injection pantap, 40 mg IVBD, injection tab Livogen, 1 tab BDPC, syrup and cool 2 TSF BD, tab Chloral, 1 tab to suck, injection mGras along with the tab morphine TDS. Next slide, ma'am. With this psychological aspect, patient always looks depressed, anxious, keep on questioning, why God this happened to me, what's wrong have I done? Guilty, feeling guilty about the past. Patient becomes weak emotionally. Patient think about financial problems. These are all what whenever we go to the site with her, she always have these what. So what are our main concern? Advanced cancer and limited anti-cancer treatment option, patient quality of life changes in lifestyle, patient expectant, patient psychological, psychosocial and financial support. Patient is a known case of breast cancer since 2020. Patient's wound not healed properly and patient developed bed sore, foul smelling. Patient is under the oral chemotherapy and patient is under the oral chemo tab toxocyfen 20 mg, OD and other supportive treatment. For pain control, tab morphine given, family facing financial burden. So what are these are the point that best possible solution to ease patient present suffering and prevent further complications. Family and human resources in the form of trained nurse, volunteers and committed professionals. Local self-government institution can make positive contribution. Consider the financial status. Thank you.
Thank you, Maulam, for the presentation. Anybody need any more clarification regarding this patient story? You can ask. So otherwise, we can move on to the discussion points. So I understand that this patient is not having lymphedema, but the patient is a case of carcinoma breast, and mastectomy also done. The patient is post chemotherapy and radiotherapy. So this patient might have developed lymphedema. So that is why I asked to present this case today. So anybody need any more clarification? No, I think nobody's need any clarification regarding this patient story. So we can discuss. So we'd like to hear from the participant side. How will we help this patient? Now we almost end of our course. So if you have seen this type of patient in your settings, how will you manage? Any answers? Yes, Antonia.
Thank you, Madam. I'm thinking about the situation of the false smelling tumor. It's helpful for the nurse to prepare the metronidazole crushed powder to apply on the tumor after dressing. It reduces the false smell, and then she doesn't have to feel embarrassed. So sometimes someone can have more than one symptom. So on top of the lymphedema, we should not forget to care for the false smelling tumor.
Yes.
Okay, thank you, Antonia, for this point. So again, this patient is having a non-healing ulcer. As Antonia said, it's a fungating ulcer. You can clean that wound with normal saline, and then you can apply metronidazole powder. If there is a foul smell there, you can apply. You can put charcoal pieces near the bed or under the bed. That will help to absorb the bad smell. Nowadays charcoal dressings are also available, but the thing is very expensive. If the patient is not affordable, you can't that you can't suggest this option. Better you can suggest charcoal pieces. So that will help to try reduce the foul smell. And the metronidazole is one of the drug of choice of controlling anaerobic bacterial infection. You can crush the tab metronidazole, that is very cheap. That will help to control the infection. We can that way we can able to reduce the foul smell. Any other points want to anybody want to add any points, any comments? Kalaivani?
Yeah. Yes, ma'am. Yes, ma'am.
How do you manage this type of patient in your settings?
Sorry, ma'am.
How will you?
I'm sorry, ma'am. I cannot hear you, ma'am.
He is traveling. Jay Sharma ma'am, are you there? Anu Ashwini, are you there?
Yes.
Yeah. So how will you manage this type of patient? Gunu Rai? So if you don't give any answers, I will send these questions to your in your mail. So you have to send that answers to me. Okay. So almost we are in the end of the course. So we don't expect these kind of silence in the end of the course. You should answer. So after that, one or two sessions, after that, one or two sessions. So you should be able to answer. You should be able to give proper treatment, palliative care treatment to the patients. So that is why we expect from you. So, here this is a patient with a CF breast having foul smell and a lot of psychosocial issues and a lot of problems. So, Antonia only give some comments. Others keep silence. So, others please write your answers. I will ask Senior about your answers. I need to know. So how will you manage this type of patients if you see this type of patient in your settings, how will you manage? So we should manage physical problems, we should manage psychological problems, we should manage social problems and also we should give us spirit. We should manage spiritual problems also. This patient is having spiritual issues also. We need to manage 4 aspects of these patients. So please write your answers and send your answers in the to senior. Okay. So if you have any doubts regarding lymphedema, you can ask now. Otherwise, we can leave that. We can wind up the session. Here, this patient is this patient is CA breast post chemotherapy and radiotherapy and mastectomy also done. This patient might develop lymphedema. So here you can ask the patient for how to prevent lymphedema and give a proper skincare advice and all. So Maulong, you should give a proper advice to the patient about skincare, massage and massage, bandaging and exercise. If there is no lymphedema there, for prevention of lymphedema, you can give a proper education about how to prevent lymphedema. If there is a mild edema there, you can give a mild treatment for mild you can teach the patient about the simple lymphatic drainage also. So if you have any questions now, we have 2 minutes. We can take your question. We can take your here one question. Okay, Antonia suggests amoxicillin for 2 weeks. Okay, cloxacillin also is very good. So, okay, here we usually give amoxicillin. If you give cloxacillin, that would be good. So here we usually give amoxicillin. Okay, Saraswati put her answers in the chat box. First, personal hygiene issues to be addressed. Also check the dependence of ADL activities of daily living. Ensure the proper dressing is done with medicines as discussed. Also ensure we give a proper counseling to the caregivers and the client. Okay.
Ma'am, hello.
Yes, Kalaivani?
Ma'am, you mentioned that patient is having a foul smelling over the surgical site. So we can do the Metrogel. We can clean the wound by using the Metrogel and apply the test afterwards. So we can able to prevent the foul smell.
We can't hear you. Your voice was breaking. So we can't hear you properly.
Okay. I'm telling about the metros using the Metrogel and putting a dosing.
Yes.
Let khang tôi dùng lên. Khang tôi dùng lên. Let khang tôi dùng.
Okay, Kalaivani, we don't understand your question. Yes, Kalaivani sent that the question. Since patient is having foul smelling, will use Metrogel dressing? Yes. See, if the patient is having foul smell, you can use metronidazole dressing. So that is why that is what we were discussing before. So we can use metronidazole. This is the good drug for controlling anaerobic bacterial infection. This is a this metronidazole having topical and that effect also. You can take a metronidazole tablet and crush it and make it as a powdered form, and that powder you can apply on that area. That will help to reduce the foul smell. The next question, will magnesium sulfate dressing help in edema reduction? Not. So magnesium sulfate, if you give magnesium sulfate to this type of wound, so this is an open wound. This will, if you apply these kind of things in that wound, the wound will, that patients will be, that the first thing is distress and irritating the wound, painful. It will not help to the, it will not help much. So it will cause damage to the skin. It will cause pain also. If there is a inflammation there, you can apply magnesium sulfate. Otherwise, in palliative care wounds, like especially fungating wound or cancer wound or bedsore management, we won't suggest these kind of things. We would suggest normal saline and metronidazole. And also you should understand that if you apply any hypochlorite solution to the wound, that will damage the granulation tissues too. So better you can use normal saline for cleaning, and if there is infection there, you can apply metronidazole powder. Otherwise, cleaning and dressing is enough. Cabbage. In home setup, Kalaivani said apply cabbage leaves over the edematous area. So I don't have any experience on that. There are a lot of these kind of dressings there, but we don't have any experience. So usually in our settings, we used to do that. What type of edema that based on the edema. If there is edema related to inflammation there, we used to give antibiotics. If the edema related to lymphedema there, we used to do control. We used to do the massaging, bandaging, and exercise. Tabomorphin TDS giving, I think we can revise the here. So why this patient is having tabomorphin 10 milligram TAD? So that is the question. Maula?
Yes, ma'am.
So why your patient is having tabomorphin 10 milligram TAD? Isn't it?
Yes, ma'am, because see, like a patient on this management, see, she cannot control the pain. Doctors, they used to prescribe like for this this injection trauma, but it doesn't work with her. So they were started with tap morphine. So after starting of tap morphine, she's a bit get relief from the pain.
So, okay, thank you. The thing is morphine. If you use immediate relief morphine, it will that help 3 to 4 hours pain relief. Okay, one morphine will help to give one morphine is able to give a 3 to 4 hours pain that pain relief. Okay. So if you give a TAD morphine, so how does that patient get adequate pain relief? That is the question. If the patient is having any renal issues or any renal problem there, okay, we used to give a TAD dose. Otherwise, we used to give 4 hourly dose. So if that is the question. Is there any renal problem that patient?
No, regarding
Okay, did that patient getting adequate pain relief with 10 milligram morphine TAD?
Yes, ma'am.
How
But
much?
she didn't have.
Okay.
Like regarding with this kidney failure, she didn't have any complaint on that because, see, after giving with this tap morphine, she we can see the effective how this pain. How she got relief of the pain.
Okay. So do one thing, you can check how much, how many hour the patient get adequate pain relief after taking morphine. If the patient is not getting adequate pain relief with TID dose, we can, if there is no renal problem there, we can you can increase the frequency of dose. You can change the frequency. Okay. You can you can give 4-hourly dose. Go and talk to the doctor. If the patient is having if the patient is not getting adequate pain relief, you can take the proper history, proper pain history, and talk to your doctor, and that way maybe the doctor will be increasing the frequency of the dose. Okay. So that is the question on Guy was asking into the chat box also. The edema that appears for patient with kidney failure, what should be done to treat it? If there is a kidney failure there, we can't do so. So we will send the answers in the chat itself. Okay. Okay, we can wind up the session. Okay, thank you. Thank you for your answers. Thank you all for joining in. Okay, we can wind up the session. We can see you next week.
Thank you all once again. I have shared the feedback link with you. Please go through it and fill it up. Don't forget to go through the feedback link. Thank you all once again for attending the class. I will see you on the next class. That's our last class. I request all to be present on our last class. Thank you all.